PNH is a rare, potentially life-threatening condition that's characterized by complement-mediated hemolysis as well as thrombosis. It's actually a genetically acquired condition that happens at random periods in life. It's not associated with family history or anything like that, but it is an acquired genetic mutation that results in the body's inability to recognize blood cells as being a good thing. And so as a result, the complement system actually destroys the blood cells in a process called hemolysis. Now, there are two different types of hemolysis that can characterize PNH. One is intravascular hemolysis, which we often see in drops in hemoglobin, and we often see increases in LDH or lactate dehydrogenase as markers of that ongoing intravascular hemolysis. There's also extravascular hemolysis that happens. And in extravascular hemolysis, we do see drops in hemoglobin. We don't necessarily see the increases in LDH, but what we do see are increases in absolute reticulocyte count, which is a measure of how the body is trying to replenish its red blood cell population. In patients with PNH, they can experience sometimes debilitating symptoms, such as fatigue, occasionally pain. They can have difficulty swallowing. They can have erectile dysfunction, and certainly thrombosis is one of the most important complications that can result in PNH that's not adequately controlled. In the case of thrombosis, unfortunately, that can sometimes be fatal. Now, in this current treatment era, we are fortunate that we do have complement inhibitors, which have addressed the potential mortality associated with PNH. Complement 5 inhibitors, such as eculizumab and ravulizumab, have been a tremendous advance in being life-saving treatments for patients with PNH. There's still an unmet need that remains, and so we are seeing additional treatments undergo study in order to understand the potential benefit of additional mechanisms of action to treat PNH.